pain originating in the spinal cord and nerves, particularly in stenosis, there's no surgical option, or if you've had surgery and everything is decompressed, you no longer have stenosis, but the pain can remain after that surgery. We like to use spinal cord stimulation, which it's another implanted device. This one doesn't use any medication though. This one sends a small electrical signal along the spinal cord and basically prevents the brain from perceiving the pain that's coming up through those nerves.
Hi everybody, it's Becky with Pearson Physical Therapy, and I am joined here with Bryan Messbarger from Regenirex in Kearney, Nebraska, and we are happy to say that they come to Broken Bow, to our specialty clinic, and I wanted to sit down and visit with him and see what they're all about.
Oh, thank you. Thanks for having me on here and talking with me.
Great. So Bryan, tell us a little bit about yourself. Where'd you get your education, your background, all of that?
So, basically grew up in Kearney, did really all of my education here. So bachelor's degree of nursing in 2009, worked at Good Samaritan Hospital here, mostly in intensive care, and then got my master's degree in nursing while I was working there. And then graduated 2019 with that. And I've been working with Regenirex, about 6 months or so here, and kind of learned the pain management world and trying to spread services to other people.
Great. So tell us a little bit about that. So a pain management clinic, what makes you guys different than a regular doctor's clinic?
For one, we have some more advanced treatment options. There's so much in the medical world. No one provider can be an expert in all things anymore. So there are things that we have to offer that others don't. And in the same token, if this is our focus, we can engage responsibly in like medication management. So addressing things like the opioid crisis. And, people do need these medications, but you want certain people managing that as much as possible. So that's kind of what we do. Medication management and procedures that your regular doctor may not feel comfortable in managing themselves.
Yeah, so we get involved as a physical therapy clinic with the opioid management because, of course, if people are still having physical limitations that create the need for pain meds, a lot of times doctors will order physical therapy to help with that. And then what are some other options that you guys do with the, helping people either decrease their opioid use or get off of the opioids?
And I think physical therapy is the first option all the time. Just for the fact that it's safe, non-invasive, effective, and promotes long-term health to stay off of things. In the case that somebody does have severe pain and that's sort of thing isn't an option for, trying to use other medications to provide as much relief as possible, sort of atypical mechanisms of pain relief. That's certainly possible just as far as medication management alone. And then there are a lot of procedures that we can do to at least temporarily relieve pain, whether it's steroid injections or, things like that. Some people have a permanent, essentially, need for opioid medications. And, sometimes it's okay to continue with pills in that case. We can do an implanted pain pump that would actually deliver medication directly to the spinal fluid. And that basically allows us to control the release and use minute amounts of medication to much greater effect. Therein minimizing side effects and long-term complications associated with opioids.
Yeah. Is there somebody that would not be a candidate for that? Or how do you know if that's an appropriate option for them?
It's not the first thing we would jump to, but in select people who do seem to need that medication long term and are either on too high of doses or just don't tolerate in general, it can be a great alternative.
Yeah, and we visited a little before we started recording. We do have a lot of patients that have severe lumbar stenosis, a lot of pain when they walk, and we're seeing them here in physical therapy, and maybe epidural injections haven't worked for them, and surgery is not an option because they have different comorbidities. And so pain pump might be one thing that could be beneficial to them. Are there some other options, I guess, that they could look at as well versus surgery that might be very, actually life-threatening for some of these people?
Certainly. Specifically in regards to pain originating in the spinal cord and nerves, we like to use spinal cord stimulation, which it's another implanted device. This one doesn't use any medication though. This one sends a small electrical signal along the spinal cord and basically prevents the brain from perceiving the pain that's coming up through those nerves. So particularly in stenosis, there's no surgical option. Or if you've had surgery and everything is decompressed, you no longer have stenosis, but the pain can remain after that surgery. So it can be very effective in those situations.
Well, I will have to send a referral.
Yeah, absolutely.
Recommendation. Yeah, good. Some of the other things that we get asked about a lot are like stem cell therapy, PRP. Do you guys do that stuff as well?
We do. So yeah, we do PRP, which is platelet-rich plasma, stem cells, and exosomes are the three types of regenerative injections that we have to offer. Things to know with those, there's a lot of information out there. Not all of it's reliable, and I think there's some variation in the particular therapies in regards to how different clinics might use them. I think we try to be very reasonable about the use and reasonable expectations. It's certainly a great alternative for somebody who, the standard medical treatment hasn't been effective, or, they're just personal beliefs or whatnot, to try to be a little more natural maybe, or, and they can be effective. The thing is, you kind of have to balance out what you might read online. Is it a miracle treatment that's gonna make your joints, take an 80-year-old's joints and make them look like a 20-year-old's? Realistically, no. But can it provide some pain relief and some healing of tissues? Yes, it can. So it's really it takes some personal evaluation with us to see if we feel like you would be a good candidate. But for the right person, it's certainly a good alternative to traditional methods.
Would you say like some arthritic joints might be beneficial, or like torn rotator cuff that maybe is non-operable? Maybe they'd had a rotator cuff repair in the past and the doctors say, well, you tore it again, I can't go back in and operate.
In those situations, if we're trying to get pain relief, the traditional method is basically going to be like a steroid injection, which does provide symptomatic relief in most cases, but steroids inherently will weaken tissues and speed degeneration of the joints. Whereas the regenerative injections don't carry that inherent risk. So we can't make any guarantee as far as the effectiveness, but you will kind of eliminate that risk. So with the rotator cuff, If it's torn, you inject the steroid, is it going to tear more? Is the injury going to get worse? Whereas with the PRP or stem cells or exosomes, you have a chance of healing that enough to relieve pain and prevent further injury.
That's great. I think that's a great explanation of, the differences, because we get people in here a lot of the times that have had cortisone injections, or they rely mostly on cortisone injections to manage their pain. And what I tell them a lot is, yes, it can be very helpful, but you also have to do the work to, if you have some muscles that are really tight and pulling you out of good joint alignment, then you're going to continue to get the wear and tear. Or you have muscles that are weak and they're not doing their job to support that joint. You have to still do the work, get the cortisone injection or get the regenerative therapy that can help that problem, but you also have to address the physical limitation too. And so I think, a lot of us just want to put a Band-Aid over it, and it's a whole lot easier just to get an injection and then go back to doing your normal stuff. But if you realistically expect that problem to completely go away, I think you're just kind of sticking your head in the sand, I guess, is my thought on it. It has to be coupled with, the physical, addressing the physical limitations as well.
I agree. Lifestyle change is imperative. That it's the only way you're going to get long-term resolution. So, doing the strengthening, improving your diet, losing weight, taking strain off of your joints. Absolutely.
Yeah. It's not just a one thing, one shot, this is going to fix it. And, I'm really glad we're having this conversation, because it really does take a team. I am not an expert in regenerative medicine. I am not an expert in those things, but patients do rely on me to help advise them as to where to go next. And it's really good that we're having this conversation so that we understand where each other is coming from.
Yeah, absolutely. Yeah, I think it's, definitely hand-in-hand work.
So if you could give people like one simple piece of advice, some common themes you see across the board that you think, if I could give them, if people just knew this one thing, it would make my job so much easier, what would it be?
I think I've thought about this quite a bit, actually. And I think the number one thing is just to be aware of the wellness that you have and of feeling good while you have it, and be protective of that. An injury that takes a few seconds to do can basically sit with you the rest of your life and really impact your quality of life. Mm-hmm. So I would say, cherish the wellness that you have, acknowledge it, and be protective to maintain it.
Yeah. And I think being aware of what you're doing to maintain it.
Yeah.
Because it's interesting, when I exercise on a regular basis, when I do my stretching, when I do my strengthening, and I watch my diet, I feel phenomenal. But I'm human and I slip off the exercise wagon. I go to Dairy Queen and I get a little blizzard. And when you do that multiple times, you start feeling not so well. And I think, like you said, if you can have that awareness of, what was I doing when I did feel really good, and try to get back to that, and realize that if you do slip, you can get back on that program.
Yes. Yeah, it's not the end.
Yeah, exactly. So great. Anything else that you'd care to share with everybody, or where can they get a hold of you?
Basically either contacting through the outpatient clinic there in Broken Bow. Certainly get a hold of us through there. Otherwise, we're located here in Kearney with our main office. Phone number is 308-237-9696. We're on Facebook and we have a website, and kind of Google us. We're pretty easy to get a hold of, and we're a small clinic, we all know each other and we all talk. So if you can just get in contact with one person, we'll get you taken care of.
Okay, great. Well, I appreciate you taking time out of your busy day to do this. And yeah, just thanks again for the information. It was very, very good stuff.
Oh, my pleasure. Thanks for talking with me.